The remedial exercises we will be giving our patient is a strengthening exercise for her hip, which will help the patient maintain or strengthen the muscles around the hip. Strong muscles in turn will help support and protect the joints. The beginner stage remedial exercises for the hip will consist of the patient seated in a stabilized chair. The therapist will instruct the patient to perform flexion, extension, adduction, abduction, internal rotation, and external rotation while they're in the chair. The patient will have their arms out to the side, and they'll be holding onto the side of the chair for stabilization to decrease the risk of falling off. So I will have the patient bring their knee to their chest for flexion. And I'll have them bring their leg out to their side for abduction. I'll have her bring her right leg over her left leg for adduction. And I will have her kick her leg out for internal rotation. And I'll have her kick her leg in for external rotation. For extension, the patient will have to move their legs to the side of the chair and sit on the edge of the chair on the side that has no backboard. They will be using the backboard as support to decrease the risk of falling. They will now extend their leg that is off the edge, and that's how they will do extension of the hip. For them to do the other leg, they will switch sides, so move to the other side of the chair and do extension of the hip on the other leg. For the advanced stage of this exercise, the patient can be standing and using the chair in front of them for stabilization to decrease the risk of falling over. The patient will bring their leg out into abduction, adduction, internal and external rotation. So I'll have the patient bring their leg out to their side for abduction. And I will have them bring it towards their left leg for adduction. And I will have them turn their leg inwards for external rotation. And I will have them turn their leg outwards for internal rotation. As you can see for this exercise, the chair will just have to be in front of the patient, just leaving enough room for her legs to move in front of her. It will not be pushed out too far to reduce the risk of falling, and she will be holding onto the backboard for stabilization. For flexion and extension, she will be using 2 chairs on each side, and she will bring her leg out in front of her for flexion. And she'll be bringing her leg behind her, kicking back for extension. For this video, we didn't have enough stabilized chairs, but for the purpose of this exercise, you will need to find stabilized chairs such as this one that will not move so that the patient is stabilized, and it will decrease the risk of falling. The patient can do this 5 reps, 3 sets once a day, and switch between sets and have 30-second rest in between. Once she is comfortable with this, the amount of reps will increase to 10. I will also advise the patient to do aquafit or yoga once a day for flexibility, to increase range of motion, reduce stiffness in the joint, and to improve joint mobility. I will also advise her to walk for endurance purposes, to improve cardiovascular blood flow to surrounding muscles, and to improve her ability to perform daily activities for longer periods. This can be done every 2 days.